can you just give us a taste of what it's like to live with this condition?
Yeah, it's difficult to explain all like the ins and outs of this condition. Every once in a while I'll be reading or watching something, trying to do some work, and I just all of a sudden I get this feeling that something's watching me, something's there, but I can't quite put my finger on it, and it's making me feel like I'm going crazy.
Unfortunately, Natalie here is not the only person to suffer from schizophrenia. There's at least 20 million cases worldwide. In this video, we shall discuss the different symptoms of schizophrenia, what's going on in the brain when you have it, who's likely to get it, and the affected population, and how you can treat it when you know you have it. So here's to learning about schizophrenia. Oh my! Natalie? Let's get to the rest of the video, why don't we?
Hey guys, how are y'all doing?
We're doing great.
We're doing pretty good.
Ready to start filming this video for psychology?
Yeah, we're ready to talk about some schizophrenia.
So I'm not too familiar with schizophrenia. What are some good symptoms of schizophrenia?
So, good symptoms, I think you mean positive symptoms, okay? So, hear me out. I've done all the reading here. I can get us this video script planned, okay? So, in schizophrenia, there are two types of symptoms that we need to worry about. Positive symptoms and negative symptoms. Positive symptoms means some unusual behavior is present in a schizophrenic person that is not present in other people. A negative symptom means that the person does not exhibit some behavior that normal people do.
Okay, that makes more sense. So what are some positive symptoms that people might have?
Great question. So one of the most common positive symptoms is disorganized speech, where a schizophrenic's words might not make sense even within a sentence. That's called a word salad. And just in general, their thoughts might come out in an unlogical order.
Oh, okay. I'm taking it that there's some emotional responses that people might have as well to it, are there?
Yeah, there are. So, people with schizophrenia can have trouble seeing other people's emotions, especially reading facial expressions. They also might exhibit inappropriate emotional reactions to stimuli themselves, like getting angry for no reason, for example, or suddenly performing some sort of emotional behavior that doesn't make sense.
That sucks.
There's actually one very big schizophrenia symptom that I haven't mentioned yet. People with schizophrenia often hallucinate. They'll see, hear, and even feel things very vividly that aren't actually there.
Dude, I had no idea they struggled with that. I could not imagine dealing with that at all. That must be crazy.
Okay, so we've seen a couple of the ways that schizophrenia manifests itself, like in the emotional side and in your speech and hallucinations and stuff like that. But how do you get schizophrenia? When does it usually show up in people's lives? Well, there's two main types of schizophrenia. There's what we call acute schizophrenia and chronic schizophrenia. A chronic schizophrenia is where it usually comes on at like early or late adolescence, early adulthood, and it's a very gradual onset. So it's very, you start having episodes here and there, and as you get older, they start becoming longer and longer. And because it's such a gradual onset, recovery times get shorter and shorter, and it's a lot harder to deal with it. Now, acute schizophrenia is when you have a point of trauma. It's very like, bam, it's a big life stress moment, and it just, boom, all the symptoms start manifesting, and it's like you have schizophrenia. But the great thing about acute schizophrenia is because it's such a rapid onset, it can also be a pretty rapid recovery.
So there are three main brain abnormalities that appear in people with schizophrenia. The first one is they have larger brain cavities, and these are filled with fluid. So larger brain cavities just means more open space up there and less actual brain tissue. The second one is there's less brain activity in the frontal lobe. This is the area that people use to process things, plan things, reasoning and logic. So there's just less of that for them. And the third one is they have an excess number of dopamine receptors, which means that they can easily get overstimulated, and this could lead to their symptoms like paranoia and hallucinations. So the main idea is it's not just one thing that causes it or that's chemically wrong with their brain. It's a combination of all of these three.
What are some potential causes? Genetics play a big part in schizophrenia, although it is not passed down as straightforward as a trait like eye color. Some say that stress, environment outside the womb, and malnutrition causes the schizophrenic genes to turn on and be passed down to the baby. Now, Ivory's will tell us about the final potential cause for schizophrenia viruses.
Let's take a look at so many things that can put people at risk for schizophrenia, including but not limited to the flu virus, prenatal viral infections, a famine, high stress levels, population density. These are contributing factors for the risk of schizophrenia, and not to mention a genetic predisposition. Now, prenatal viral infections, they have been shown to increase the risk of schizophrenia in children, and a study has been done on 1.75 million, and Danes confirms this.
Okay, so by now we've seen the symptoms of schizophrenia and what types of schizophrenia there are and how people are diagnosed with this and what scientists theorize are some of the causes behind schizophrenia. Now we get to look at the really, probably what you're most curious about is how do we treat schizophrenia? How do those with schizophrenia live with it? It's a chronic condition. It's not something that can be cured per se. So how do we advise them to live with this condition? There's a couple different things we need to take into account. We need to take into account the medical side of treatment and then the therapeutic side of treatment. So here in the medical side of treatment, one of the things that schizophrenics often will do is they'll take antipsychotic drugs, which there's a lot of fancy names for what types of drugs are out there. I can't pronounce half of them. But the main thing they do is that they block the dopamine receptors in the brain so that they get less of the crazy symptoms like hallucinations and stuff like that. Another drug that they can sometimes take is just mood stabilizers when they have those crazy bouts of depression. That can be really helpful for some people who are schizophrenic. A very intense method of medical treatment that not many schizophrenics will do, but some will, is called electroconclusive therapy. And that's actually where they use brief electrical stimulus on the brain in order to help. It's a very intense therapy method. Go look it up if you're interested. It's very intriguing. On the therapeutic side, it is very important to remember that anyone with an intense mental disease like this should not be working through it in isolation. One of the main things you can do to help yourself if you have schizophrenia or to help a friend who does have it is just make sure they have a really good supportive community so that they're not stuck in the darkness of their own mind, but they can actually see the light shining through. So good family support, good friend support, good therapy and counselor support. These are all great ways to deal with schizophrenia.